So I'm going to talk about the work that we've been doing in using polymerizations as a means for detecting cancer. Tad did a very nice job, I think, of setting the stage for obviously some of the treatments of cancer that are critical. What I want to do is take a step back from that and say, all right, how can we diagnose cancer earlier? And so if we're able to diagnose it earlier, have more treatment options, including these various drugs that are being developed, as well as better treatment options and better outcomes for the patient. And that's really our goal. And I think I've created a presentation which has no equations and no chemical structures in it. And so I both apologize for that and am happy about that, I guess. So when I don't explain things clearly, feel free to ask questions, stop me as we're going along. Definitely there's room to get into a lot of details in discussions afterwards, as well as other times. I wanted to try to give this presentation at a level, hopefully, that everybody could understand it and really motivate some of the work that we've been doing in this area. And so our group works extensively on photopolymerization reactions. And as I showed, I guess, on the first slide and didn't talk about, we have a very large group. One of the things that we do, about a third of it, and this is all of the people from my group who have worked on that, and I've been very fortunate to have grad students and postdocs that just do an exceptional job. The collaborators outside of my group, including Kathy Rowland, John Bergs, Rob Kunchta, and Rob Jennison, who I've worked with extensively as well, that have helped in a variety of areas. But our group focuses on photopolymerization reactions. And I have this disadvantage when I talk to a lot of groups that, you know, Tad can come up here and he can talk about how the molecule he's working on, the evolved form of that, really hasn't ever existed before. It's something that's come about in the last couple of years. Many of the techniques that he has actually are very recent, etc. The photopolymerization reaction isn't like that at all. It in fact goes back way back to the ancient Egyptians, and even beyond that to some other techniques that were used. But the ancient Egyptians, I think, works as a fantastic example, especially to talk about biomaterials applications. So the ancient Egyptians, as part of their mummification process, after the body was all prepared and had been had the internal organs removed, basically been dried down, etc., they would wrap it in rags. Well, those rags were treated with everything that we need to do a photopolymerization reaction. And that is, they were dipped into a resin. That resin contained an unsaturated compound. Actually, natural oils are very capable of undergoing polymerization reactions. Those natural oils contain carbon-carbon double bonds that polymerize relatively readily under the right conditions. That resin contained a chromophore. That's the other thing that we need to conduct a photopolymerization reaction. Basically, something that absorbs the light and ultimately leads to the formation of active centers once a photon has been absorbed from the light. And then the last thing the Egyptians got by taking the body that had been wrapped in these rags, dipped in the resin, they put it out in the sun. The sun gave the last component that we need to initiate a photopolymerization reaction, and that's light. All right? And that actually shows many of the different advantages of photopolymerization. That is, the reaction doesn't happen till we want it to, doesn't happen till we have both initiator and light present, so I can actually very specifically control where I get polymerization by exposing to light, or by controlling, as we'll show in the detection aspect, where I get initiator molecules. If I expose to light and I have monomer present, if I don't have those initiator molecules, those chromophores that I talked about, I don't get polymerizations. So in the case of the biodetection applications, what I'm really interested in doing is trying to figure out ways of coupling those chromophores to the biodetection event of interest so that ultimately I only get polymerization where I want to have, or where it's indicative of biodetection aspects. So from the current biomaterials applications, it's actually very much a stealth technology. I would guess that until I put this list up here and I go into a lot of different classes and ask this, including freshman chemistry when I'm teaching about photopolymerizations end of the semester. I give one lecture typically on this topic just because I like it so much. And very few people can even name a single application that's used for photopolymerization. This is just the biomaterials applications. Many of your coatings are cured by wood, etc. But we talk about contact lenses, probably somewhere on the order of 80 to 90% of contact lenses are cured via photopolymerization reactions. Dental materials, if you have a tooth-colored restoration in your mouth, it was photopolymerized actually in your mouth, all right? If your kids had sealants put on their teeth, I expect most of us are too old to have had sealants put on our teeth, but the current sealants that are put on teeth, those are all photopolymerized. The brackets on braces that are attached, right, those are photopolymerized. Right? There's numerous applications for this, and they're ever expanding. I mean, you talk about tissue engineering, tissue adhesives. There's a lot of applications going forward that people are pioneering and really trying to use photopolymerization for. And the reason is that, and I have a slide on the advantages here, is that we can do things with a photopolymerization. I talked about kind of controlling in time and space where polymerization happens. But it's actually very important for it to be a robust technology if we want to use it for detection as well. And that means that I need to be able to cure in ambient conditions, at this temperature, this composition, etc. And I need to be able to make that go. It turns out that it uses very simple chemistry. And so unlike the biological side of things, where if I want to do most biological detections, or if I want to do PCR, those processes get very, very expensive when I want to do them on large scales. If I want to make a gram of an antibody, or I want to make a gram of an oligonucleotide, you'd be frightened at how much that would cost. If I want to buy a gram of the monomers and the initiators that I'm using here, we're talking about dollars, all right? Individual dollars, not even tens of dollars for the cost of the materials. Variety of other reasons it's used for other commercial applications. Some of the disadvantages are here. Outside of oxygen sensitivity, which I can talk about, most of those are not really relevant to the biodetection application. And so one aspect of photopolymerization, and I skipped over the mechanism of that, is that the photopolymerization reaction is such that when those ancient Egyptians were doing the mummification process, the number of chromophores present in that resin was actually very, very small. Typically something on the order of a part per million or a part per 100,000. Or if you do it right, a part per billion, or even lower levels of that chromophore can actually cause the reaction to occur. And that's because the polymerization reaction itself is exactly what it says. Polymerization means bringing many things together, many repeat units coming together as one. And so in the photopolymerization reaction, I have one chromophore or one initiator. It absorbs light, turns into two radical species in the case of our polymerizations. There are a variety of other active centers that can also be used. But once those active centers are generated, those radicals, they actually go and they react with many, 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 many monomer repeat units. All right? And for biodetection, as I indicate here, that's actually perfect. Because what we know in biological systems is we don't have a large number of molecules to work with. And especially if we want to detect diseases like something like lung cancer or ovarian cancer by a simple blood test or urine test or sputum test, there are not many molecules indicative of those cancers in somebody's blood at the early stages of those diseases. I'll show a slide here in a little bit, but essentially if we want to diagnose lung cancer at really early stages, we have to be able to detect somewhere on the order of a total of 100 or 1,000 molecules in that sample of blood. Right? And to put that in perspective, the number of molecules of air in this room is on the order of 10 to the 25th. Right? 22 more zeros, 22 more orders of magnitude, more molecules of air in this room than there are of oligonucleotides in the blood sample that we want to be able to detect. So if we want to have a diagnostic test that's appropriate for somebody to walk into a room that might be a high-risk lung cancer patient or a high risk for lung cancer, what I have to have is something that's very simple to do. The test has to be very, very cheap, right? Because if somebody's going to walk in and have this test done every 6 months or every year, no insurance company is going to pay many thousands of dollars or even probably hundreds of dollars to have that test performed. They want that test to be very simple, very cheap, very easy to read, all right? And they want it to be very robust. That requires something that uses many of those advantages of photopolymerizations, right? It requires something that has cheap molecules to be used. It requires something that can amplify a signal to a very, very large extent, all right? And make something ultimately that can be seen.